What are the most common early signs of pediatric cancer?
So any fever which is lasting for more than 2 or 3 weeks,
Okay.
where we don't have any reason. Most common symptom is pain, fever, lump, bony pain, weight loss. The child is appearing pale all of a sudden, or he's developing bruises on his body without any history of trauma. So that is when we have to consider like all these are red flags. That cancers in children are rare. Any age group, a child can get cancer. The incidence is only 5%. Parents tend to show me photo or the video ये सिर्फ 2 दिन पहले का था. So how is it possible that my child has
Cancer.
cancer? It is very difficult to believe that the child has cancer because children, unlike adults who usually have, they kind of show the fatigue, they show the tiredness. Not often we see a child complain of, they still continue to run around,
Yeah.
they're active.
Their adrenaline is too high.
So AI-based tools are coming up which can detect these lesions even on the imaging early. So if I do a CT scan, artificial intelligence will be able to pick up whether this is an infection or this is a tumor. It is liquid biopsy is a circulating tumor DNA. He has done his treatment. We keep monitoring the tumor DNA to check if the patient is going to relapse. So children usually tolerate chemotherapy much better than adults because they don't have other risk factors. Like an adult patient has hypertension, he has diabetes, he has lot of other risk factors. Child doesn't have all this.
Every parent knows what a child's fever, tiredness, or even bruising looks like. But sometimes the most ordinary symptoms are the ones that need the most attention. In India, over 50,000 children are diagnosed with cancer every year, and in so many cases, the early warning signs were visible, just not recognized. The hopeful part? With every detection, a child's survival chances are increased by up to 60 to 80%. So, today we're talking about something every parent deserves to know: what early symptoms matter, what's normal, and when to take action. And to guide us through this crucial topic, we have with us Dr. Swathi Krishna, a leading pediatric cancer specialist who has helped hundreds of children and families through this journey. I am Keyur Vaze, and this is MOC Cancer Ki Baat. Let's begin a conversation that might help save a life. Welcome, Dr. Swathi. It's really great to have you here. My first question would be, what are the most common early signs of pediatric cancer?
Yeah. So the most common symptoms that we have to look out for. So any fever which is lasting for more than 2 or 3 weeks,
Okay.
where we don't have any reason, like it is not cox, it is not typhoid, all the tests have come negative. So any fever which doesn't have a focus, we have to be cautious whether we are looking at malignancy. So apart from that, one of the most common symptom is pain. So very often children complain of pain. Parents just think that they just tend to overlook the symptom. So pain which worsens at night. So night pains are usually quite significant. A pain which does not settle even with some routine painkillers and which is disturbing the child's sleep. That is something which needs
be
to be
alarming.
looked at. Yeah. So apart from that, any lump which is new onset or which is like increasing gradually, and usually cancer lumps tend to be non-pain, but they're not painful. So that is the reason why it tends to get neglected. So fever, lump, bony pain, weight loss. The child is appearing pale all of a sudden, or he's developing bruises on his body without any history of trauma. So that is when we have to consider like all these are red flags. So one or more symptoms, definitely the patient needs to be evaluated.
Okay. When it comes to children, is there any issue in getting the diagnosis done at an early stage because of maybe lack of technology, maybe lack of their early signs, etc.?
So as such, what tends to happen is that childhood cancers are rare. So that is what I usually mention in all my awareness talks. That cancers in children are rare, but they are not like not possible, right? So any age group, a child can get cancer. So the incidence is only 5%. So that is the reason why it tends to get overlooked. The main reason what happens is that when a child has a fever or the child has a lump, we think of benign conditions first,
Right.
right? So we think of an infection. Very often the child gets treated for tuberculosis, the child gets treated for like any viral infection. We dread, as a pediatrician or a physician, we don't want to think about cancer. That is one of the most common reason why it gets delayed. So otherwise, the most of the investigations like a biopsy or an imaging, they're very well available. Like in a city like Mumbai or any
Metro. Metro
yeah,
or tier 2, yeah.
yeah. So there, it's never an issue. Like availability, the imaging or the biopsy, it is not a major issue. Yeah.
Okay. What is a big difference between
Mhm.
a symptom that an adult cancer patient
Mhm.
has and a child who has cancer has?
Yeah. So usually, more than the symptom, I would say that the nature of tumors itself are very different. Like in children, we see more of sarcomas,
Okay.
and in adults, we see more of carcinomas. So sarcomas are more from your bone, your muscle, the fat, the connective tissue. Because children are rapidly growing, right? All the cells in the body, they're dividing. So whenever there's a rapid growth, always in the body there's a tendency for spontaneous mutations and all that. So that is why in adults we see a lot of lifestyle factors, aging. So all that itself contributes to a tumor. In children, that is not the case. So often, like sarcomas, we see like more than half of the patients that I treat, they are sarcomas. So sarcomas are almost 15% of the cancers
Okay.
in children, but in adults, if you see, they are just 1%.
Okay.
So children, the tumors per se, they're very rapid, right? So very often, actually, what happens is that like the parents tend to show me photo or the video. ये सिर्फ 2 दिन पहले का था. So how is it possible that my child has
Cancer.
cancer?
Correct.
Right? Like often it is like even we tend to, how can this happen? So the same happens to any physician who's seeing the child. It is very difficult to believe that the child has cancer because children, unlike adults who usually have, they kind of show the fatigue, they show the tiredness. Not often we see a child complain of, they still continue to run around,
Yeah.
they're active.
Their adrenaline is too high. Yeah.
Yeah. So that actually makes it very tricky for the physician and the parents to believe that there's a possibility of cancer here.
Right. Now you mentioned sarcomas and carcinomas.
Mhm.
What is the difference between a sarcoma and carcinoma?
The origin is different.
Okay.
So sarcoma is basically from the connective tissues,
Okay.
right? So like in adults, we see a lot of lung cancers, breast cancers, cervical cancers, oral cancers. We don't see any of these in children. We see more of tumors from the muscles like rhabdomyosarcoma, some kind of neuroblastoma, and we see like from the kidney we see Wilms tumor. The origin itself is very different. The tissue
Okay.
origin itself.
Now, when it comes to children in
Mm.
general, they have some or the other. I mean, they're coughing, they're sneezing, they're falling sick every now and then
Yeah.
till 5 to 6 years, 7, 8 years. How much does these regular checkups also play important role in the early detection of
Yeah.
cancer?
So very often what happens is that the first few years the parents are visiting the pediatrician for vaccination. So usually as a protocol, when a child visits the doctor, the pediatrician, they do a general physical examination where the child is checked for lymph nodes, the neck is checked for any swelling, the tummy is checked for any swelling. So this protocol is routinely followed by most of the pediatricians. Sometimes the parents tend to like default. They skip these visits. So when these routine examinations are missed, some tumors don't get picked up early, right? So, and one more thing, like you said, having a cold and cough. When a child has cold and cough, very often his neck, there's a swelling. We call the cervical lymph nodes, they are swollen. This one is usually painful. And this is part of the illness, it is part of the infection, right? When the child is evaluated by a pediatrician, they very well know that this is not because of an infection. Because any lymph node which is enlarged because of cancer, they're usually larger and they're hard and they're non-tender, right? So they are red flags which a pediatrician can pick up early.
Okay.
And when in doubt, they always refer to us
Right.
for confirmation. That is when we take it forward. We do a biopsy and then we plan the subsequent.
Right. When a parent sees these symptoms, or let's say after watching our podcast, if a parent sees these kind of things in their kids, what should be the first action that they should
Yeah.
make?
So I would tell the red flags we have already spoken about. So
Yeah.
any symptom that is persistent,
Hmm.
right? Or if it is unusual. So usually the mothers sometimes when the child is even little bit they notice that the activity is on the lower side. They come to the doctor, but the doctor is seeing for the first time. And we see the child is running around. We are still like मतलब
He's
हो
normal,
सकता है
yeah.
क्या यार ये तो normal है. The mother usually tends to pick up even minute
Minute, yeah.
changes. They pick it up very early. So I often, whenever a parent comes to me the second time or the third time, so I think whether am I missing something.
Correct.
Maybe I should investigate this child. So instead of just dismissing that this is something very routine or very trivial, it is better we actually
Get it
yeah.
addressed. Yeah,
So
right.
that is something that I have learned over a period of like 6 7 years, that if a mother or any parent is coming to you and they're trying to specify or point out that somehow this like my child is not looking okay to me,
Hmm.
it is better we investigate them, run some blood tests or the imaging, that we pick it up early. So parents, they feel anything is persistent, anything is unusual with their child, they should definitely go to a pediatrician, get the child examined and run some blood tests if required.
Right.
Yeah.
Can you share a few examples where
Mhm.
early detection of the cancer actually made it a difference when it comes to the treatment
Yeah.
and the recovery both?
So the early tumors or the lowest tumors, they are the tumors that every oncologist is very happy treating. They're like, wow, now I'm going to see very good outcomes. So unfortunately, in our country, most of the tumors, at least in children, what we see it more towards like after it has spread or progressed to other organs. But yeah, all these patients who were diagnosed very early, they're always like they are remembered. Like I had this patient who was 10 years old. Mother noticed a very small swelling in his collarbone. It was very small. In fact, anyone would have missed it. But then, well, something is not okay. He did not have any fall. So why the swelling? In fact, that swelling was so minimal that anyone would have missed it. So then she went to the pediatrician. The pediatrician did an X-ray. There was something unusual in the X-ray. That is when the child was referred to a orthopedician, a pediatric orthopedician. The pediatric orthopedician did an MRI. So he noticed that there was a swelling in the clavicle, the collarbone. So then a biopsy was done. It was Ewing sarcoma of the clavicle or the collarbone. So this is a bone tumor, and that particular site is quite rare. We don't see that often, and it had not spread anywhere. It was picked up very early, so we just had to give chemotherapy. He responded really well. Like within 3 4 months, the tumor had regressed significantly. The surgery was also very easy. So in this case, he just had to the entire bone had to be removed, the collarbone. There
Oh,
was no need for often when we see bone tumors, the surgery is quite complicated because they need an implant, they need a lot of rehabilitation following the surgery because they're usually these tumors are seen in the long bones. So because of that, children, even normal routine activities like running around, walking, and they
all
cannot
that
do
is
that.
hampered.
Yeah,
Yeah.
it is hampered. But here in this case, in this particular bone, it did not have a major impact on his activities. The surgery was done very well, and we got good tumor margin. So usually, if the margins of the tumor is cleared, we say that this is a good response. So he did not require radiation. So
Wow.
otherwise, these bone tumors can be very notorious to treat. They have the tendency to relapse early. They need radiation. They need a lot of chemotherapy. Here, it was just very smooth. The entire process went really well.
So that is kudos to the mother who
Yeah.
actually picked up on that small bump
Yes.
and
Yes.
flagged it
Yeah.
on time. Doctors caught it on time, and
Yeah.
then the kid also responded
Yes. But
to the treatment
everything was
well.
done probably
Yeah.
within less than 2 weeks.
Wow.
So that is something really you don't often see that.
Correct.
You see patients coming to you after 2 to 3 months. Like everything done within 2 weeks is not very something that you see often.
Correct. Yeah.
Yeah.
Lovely. So, is there any ongoing research that is going on when it comes to pediatric cancer detection and treatment?
So when it comes to pediatric tumors, as we all know, that artificial intelligence is something that is picking up drastically. So AI based tools are coming up which can detect these lesions even on the imaging early. So if I do a scan, a CT scan, artificial intelligence will be able to pick up whether this is an infection or this is a tumor.
Wow.
So we can the whole process gets faster,
Yeah.
right? And even we have these liquid biopsies, which is very much like in adult tumors, they're very commonly done. They're used for monitoring the patient. So this liquid biopsy is a circulating tumor DNA. So even after the patient is he has done his treatment, we keep monitoring the tumor DNA to check if the patient is going to relapse. So you can diagnose a tumor way
Much
before
earlier.
the swelling sets in. So this is something that is coming up for a lot of pediatric tumors. It can make it very easy for diagnosing relapse early and initiate the treatment early.
Correct. Oh, what's a response treatment difference between an adult patient when it comes to chemotherapy and a child?
So children usually tolerate chemotherapies much better than
Oh,
adults.
okay.
Yeah. So because they don't have other risk factors, like an adult patient has hypertension, he has diabetes, he has a lot of other risk factors. Child doesn't have all this. So that is why even some kind of complications like febrile neutropenia, all that is relatively easier to treat in a pediatric patient than in a adult. So that is why when picked up early, like all my patients know that if they have fever, they have to come to me within an hour.
Hmm. Yeah.
So once they come on time, we start the process, we start the antibiotics and all that. They respond really well. So the prolonged admissions, the we often see children landing up in the ICU because they've presented very late. So this happens only when they come late. If they, they understand the golden hour. We always call the first hour as a golden hour. They come within an hour of fever, they are going to do very well. They're going to respond to the antibiotics really well. So children do much better.
Than the
Only thing is
adults.
like if the tumor has metastasized, then the outcomes they do come down drastically. But even in some tumors like Hodgkin's lymphoma, all lymphomas, uh, even if it is stage 4, still they do very well. So
Wow.
yeah, but
Okay.
otherwise any tumor which has spread to the lungs or any other organ, it is little challenging to treat such patients. But it is not like we don't have options. We definitely have options, but the course is going to be longer and a lot of complications.
When it comes to the awareness of pediatric cancer and giving these cancer patients or cancer children, that confidence, how much and to what extent can school and community can help?
Yeah. So actually, like I do a lot of awareness talks. I meet the children, I talk to the parents, I talk to the teachers. So it is more about inculcation of healthy habits that I talk about,
Okay.
right? In children, usually screening does not have a major role.
Hmm.
Like how in adults we do mammography, we do pap smears for picking up breast cancers, for picking up cervical cancers early. So in children, that is not there because screening doesn't have a role because the percentage of the incidence is lesser, right?
Right.
So looking specifically for a cancer is not something that we target. But when I talk to the children, I talk to them about inculcation of healthy habits
Hmm.
because these are the kids when they grow into adolescence. They after 18, these are the same kids who are going to inculcate all these habits like tobacco chewing, smoking, and all that. So all these risk factors in the long run, they're going to be very harmful.
Right.
So when I talk to them about inculcation of healthy habits, I talk to them about some symptoms to watch out for, and I ask them to spread the word. Like especially when the child goes back home and tells the mother about the importance of self breast examination.
Oh yes.
It makes a difference, right?
Right.
So the teachers also understand about self breast examination. So that way, not when I talk to them, it is not exactly about just childhood cancers. I talk to them about
In
everything,
general
yeah,
health.
in general as
Yeah.
well, so that they inculcate some healthy habits, understand the importance of exercise, meditation, yoga, and all that.
Right. So helping them better become a better
Yes.
healthy human is something that you have focus
Yeah.
on. Dr. Swati, thank you so much for joining us on this discussion and helping us spread the word for pediatric cancer. I'm sure this is going to help a lot of families and going to help a lot of cancer survivors.
Thanks a lot.